Hello, this is Angie Burns, the owner and publisher of Allen City Lifestyle, and welcome to the Allen City Lifestyle podcast. On our podcast, we celebrate the positive, supportive, and inclusive contributions of local businesses, organizations, and individuals making an impact on our community. We like to celebrate all of the amazing things that are going on in Allen, Fairview, Lucas, and Parker, and share them with our listeners so that you know the best-in-class businesses, the organizations making a difference in our community, and the individuals who are making an impact on our residents here in our area. Hello, and welcome to City Lifestyle with Angie Burns. We are so glad to have you joining us today. Our guest today is Dr. Eva Mackey, who is the founder of Gym MD in Rockwall. So thank you so much for joining us and being here with us today.
Thank you so much for having me. I really appreciate the opportunity to be here and to talk about my practice.
Well, I love having people on who do things that are unique and different, and you do something that is so original that it almost is going backwards in time. So we used to have family practice doctors. Everybody, the town had the town doctor and everybody knew their doctor. And then we became this commercialized wheel of turn and burn. And it doesn't feel like we have that intimate relationships with our doctors anymore. And so you've kind of, instead of reinventing the wheel, you've gone back to the wheel instead of trying to make it something new and different. And I love that about you. So tell us a little bit about Gym MD and the foundation that you've built.
Okay, yeah, thank you. I love talking about my practice and what makes it different. So just a little bit about me. So I graduated from medical school more than 20 years ago. I went to the University of Texas Medical Branch in Galveston, did my residency in Denver, Colorado, and I am currently a board-certified family physician. So right out of residency, I did what most doctors do, and I found an employed position. So I was an employed physician working for like big box medicine. I don't want to say the names, but you know what I'm talking about. The places that are probably your insurance is going to direct you to. There's multiple doctors, and it's not owned by the doctor themselves. So I did that for a long time, and I worked in that system for over 15 years. And frankly, much of the time I was really frustrated with it. And I saw that there was a lot of doctors job hopping. Most of the doctors shared the same frustrations that I did, and they would go from one employer to the next, and no matter what they did, it was the same stuff. It was like the same poison.
You had rules you had to follow that weren't necessarily the way medicine should be practiced.
Right. I mean, you go to school for all these years and you learn how to take care of your patients. And then you get into these positions where you're employed and you have large corporations telling you what to do. You've got insurance companies, you've got Medicare, you've got Medicaid telling you what to do. And you're like, wait, I think I know, this relationship is between me and my patient. And I think that my patient and I can figure out the best way to deal with
I found that a lot when I was a teacher. So I taught for nearly 2 decades, and I went into teaching to be a teacher and to connect with students and help grow students. And then once you get in, it's all paperwork and it's all politics and it's all red tape. And it's like, I can't do my job because there's so many things prohibiting me from that. So I ended up founding my own private school that didn't necessarily have to follow all the rules and regulations. So I feel like it's kind of the same thing. Like they've put so many limitations in place, and with insurance and all of the things, it's just, you can't do the job you set forth to do anymore.
Absolutely. So, I'm a family physician, so it's all about that relationship with the patient, but the large corporations and the insurance companies undermine that. And you patients are familiar with the frustrations. I mean, I don't have to tell you everything, but you can't get an appointment with your doctor. It may take you 3 months. You wait in the waiting room for an hour and your appointment is 5 minutes long. By that point, if you've waited so long to see a doctor, you've got a long list of things you need to talk about, but they tell you can only talk about 2 of those things and you've got to come back to talk about the rest of those things. And so
they bill you separately for everything you talk about.
Yeah.
And you're like, what is happening right now?
Yeah. What is this? Yeah. Every little thing they do, they unbundle the bills exactly. So they nickel and dime you for each and every little thing. And you never know what it's going to cost. And even if you ask, they can't tell you up front. front. You get the surprise bill like 3 months later for $1,000 or whatever that nobody was transparent with you up front. And frankly, it's not because they didn't want to. Most of the time, it's just because they themselves didn't know, because the billing is such a complicated equation and between the doctor's office, the insurance company, and there's so many factors that play in that most of the time they just honestly don't know what the price is. And
so how have you been able to kind of circumvent the system and eliminate that frustration for your patients?
Yeah. So that's a good question. It's because I spent a long time thinking about how to solve this problem. And I was watching other doctors who were frustrated like I was, going from one job to the next, and it was the same thing. And I'm like, okay, so I'm not just going to job hop from one place to the next. I need to find a real solution. And so I spent a lot of time thinking about it. And I really came to the conclusion that there was 3 big bad players making this system horrible for both the doctors and the patients. And I decided that it was the large medical corporations, the insurance companies, and Medicare, Medicaid. And so I said, okay, those are the things polluting my relationship with my patients and making it impossible to provide the care that they need. So how do I practice without any of those things? And that's not to say that you don't need insurance for catastrophic events like hospitalizations and things, because you do. But I don't think that it has a place in primary care. And I don't think that I, as a family physician, need to be billing your insurance.
And going to you, anybody can go to you because you don't go through the insurance. And that's a frustration that I've had as a parent is I found a doctor that I love, and then a year later, they're like, oh, we no longer take your insurance. And so now you have to go find a new doctor. So we don't have to do that now that I've switched my family over to Dr. Eva and Jim MD, is we know that no matter what our insurance is, no matter what it is, we can see you and we see you and we get to talk to you. And anytime that we need you, you're available to us.
Absolutely.
So explain a little bit more about the concierge model that you have for your patients that is so different than what you typically find nowadays in primary care.
We have more fantastic information coming your way, so stay with us because City Lifestyle with Angi Burns will be right back. At City Lifestyle, we only partner with best-in-class businesses. And a lot of times people will ask me, well, what does that mean? We do a very rigorous vetting process for anyone who is allowed to advertise in our publications. We only partner with people who are 4- and 5-star businesses and who have great reviews with Better Business Bureau, have all of their licenses and certifications up to date. We want to make sure that our readers and listeners are only being recommended businesses who are going to go above and beyond, so you know you are getting a best-in-class business.
So what I'm practicing is called direct primary care, and it is a kind of concierge model in that there's a membership. So when I was thinking through this and trying to figure out what to do, I did a lot of research online and discovered that there was a grassroots movement among primary care physicians to reconnect directly to their patients without the middlemen that I mentioned, the insurance and large corporations. They were calling it direct primary care. And that means a contract directly between the patient and the doctor, nobody in between. And we also switched to the membership system instead of fee for service. And there's a reason for that, because when you are doing fee for service, and that's where you pay for each individual appointment, there's pressure on the physician to cram as many people into one day as possible. And there's also where there's a disincentive for us to get on the phone and talk to you, or email you, or text you, or have any form of communication or interaction that doesn't involve an actual office visit. And so I wanted to make the relationship between the physician and the doctor more like a real relationship. You know, it takes many different forms. Sometimes it's texting, sometimes it's emailing, sometimes it's phone calls. Sometimes it's telemedicine, which I was doing before COVID, before it was cool. Sometimes it is an office visit. Sometimes people need to come in. So I wanted to make it a more flexible type of relationship that didn't rely on these really short office visits. And then I wanted to be able to give the individuals the time they need instead of cramming as many people as possible into one day. The focus is now on just taking the best care possible of each patient. So, and that's what a membership does, as opposed to the fee for service.
And with the membership, whenever you get sick, it seems like, when it rains, it pours.
Right.
So you get sick and then you get one illness and then you get something on top of that and then something on top of that. And you can end up going to the doctor 3, 4, 5 times in a month.
Yeah.
But then with a membership, you can go 3, 4, 5 times a month and your bill is the same. But then next month when you're feeling better and you're healthy, you still know, okay, well, that's my bill and that's taken care of. You're almost like prorating yourself out for all of your care throughout the year. So when you need it, you don't have to go, okay, I can't go to the doctor because I can't afford it right now. Right. You already know what you're going to be paying before you go in. And that just seems like a huge stress relief for your patients as well.
Absolutely. So price transparency is really important. So, this is, like I said, this is a relationship-based medicine. It's all about the relationship between the doctor and the patient. Mm-hmm. And nothing will erode that relationship faster than surprise bills.
Right. Yes.
So the membership helps to eliminate the surprise bills.
Now you still do have extra fees for like blood work and things like that where you have to send it out to a lab, but it's not going to be astronomical like when you go into an ER and then you have all these different bills coming in from every single person who set eyes on you. You're like, oh, the receptionist just sent me $4,000 bill. Great.
Yeah. No, you're right. So I've bundled as many fees as possible into that membership, so there's not a whole lot of extra stuff. A lot of things are included, like EKG, strep test, flu test, urinalysis, vision screen, hearing screen. But some things I do have to charge for because, like, for example, the blood test, because we draw the blood in my office and then I send it out to outside labs to get processed, and then they bill me. And so I can't absorb that cost. I have to pass that cost on. However, because I've opted out of insurance and Medicare and Medicaid, I can bring those prices way down. Yeah. Because when you're billing insurance, Medicare and Medicaid, you're going with the contracted price for that insurance company, which is inflated at least like 10 times what it should be. I mean, it really
always
high.
Blows my mind that whenever you go in somewhere, like my daughter was really sick and we went in and with our insurance, it was going to be like $1,200 for her to have like this colonoscopy or something that she needed. And then I was like, well, what if I didn't have insurance? And I'm like, oh, $600. And I'm like, wait a second. Yeah. Why do I have insurance?
I know.
It's like, it doesn't make any sense. Yeah. It's a catch-22.
Stay tuned. We will be right back with City Lifestyle with Angi Burns after these short announcements. Thank you for tuning into City Lifestyle with Angi Burns. We are committed to being involved in our community and giving back as much as we can. If you would like us to come out and throw a neighborhood block party for your community, please contact us. We bring out bounce houses, DJs, ice cream trucks, and we would love to get your feedback on our publication and introduce you to our highly qualified and vetted advertising sponsors. We do not sell anything at the events. We just come out, throw a party, and get to know our neighbors so that we know how to best serve our community. So let us know if you would like us to come out to your neighborhood. We typically serve our neighborhood for block parties during the months of May, June, July, and October for trunk or treats. So reach out to us at Angi, ANGI.Burns@citylifestyle.com to book your City Lifestyle block party today.
You do need the insurance for the truly catastrophic, like, God forbid, a cancer diagnosis. But for the vast majority of things, you don't need insurance. So, like, for example, a lipid panel in my office, now that I've negotiated the fees down, it's only $5.
Wow.
Yeah. And, if you were to go to a traditional doctor's office and get the same test, it would be, I mean, you never know. It's just always, it's up in the air. It depends on your insurance company. Maybe $100. I don't know, and if you're lucky, they pay for it. But a lot of times they don't. And you really never know when they're going to pay for it.
And being a comprehensive primary care physician practice, you can deal with a whole gamut of different ailments or illnesses, anything from, I know you're going to be seeing my son for ADHD and you can help with those type of meds. You help my husband with a weight loss med.
Yes.
You have a comprehensive practice. So people can go to you for essentially whatever their issue is, and then you can refer them out as needed. But talk a little bit about all the different, because you're not by yourself. Right. You have a team. She has an amazing team, amazing staff in her office, and they do wonderful things. So talk a little bit about the team you've built at Gym MD and how they help support your mission.
Okay. Yeah, so I do have a team. So I have a nurse practitioner who helps me. I also have I have 3 amazing virtual assistants. They're actually virtual RNs, and they handle all of the phone calls and the text messages that come in. And I've got my front desk who gets your vitals and does the EKGs and the blood draws. But I also have some additional services that I offer in the office. For example, we do the weight loss. And so I prescribe the injectable weight loss medicines. They're so popular and so effective. But I also really, really believe that lifestyle changes are key. So I have a lifestyle coach. He does both nutrition counseling, and he can also help with personal training and things like that. So we have a comprehensive weight management program and using our lifestyle coach. We also offer IVs. So
the IV therapy. And it's summer right now. I know when you're watching this, it might not be summer, but in Texas, summers are hot. And hydration is so important.
Very important.
So anybody can go in and get.
Yeah, you don't actually have
IV?
to be a member. You don't have to be a patient, an established patient to get an IV. We're willing to do that for anybody. But that's really important because, summers are hot. A lot of people who are working outdoors, they could be mail carriers or roofers or AC people, or those folks are getting super dehydrated, or just anybody,
or if you've had a long night out at the bar the night before and you need, there's always that. I mean, it's helpful. It's
right.
The healthy hangover recovery is to go get an IV from Dr. Eva.
Right. And a lot of people are drinking sports drinks, or not like energy drinks that have a lot of caffeine, and that doesn't actually keep you hydrated. You need to be drinking something without caffeine. But anyway, we can get you hydrated.
Awesome. Well, if people want to come and visit your office, so tell us where you're located and what the best way to reach you is so that people can come in and learn more about GymMD. They can also come in and meet you and your team and see if it's the right fit for their family.
Yeah, absolutely. So we're in Rockwall, and we're right off of Lakeshore Drive in the middle of the Shores. It's a nice neighborhood in Rockwall. And you can call us at 972-961-4171. You can email me at Dr. Eva, that's dr.eva at rockwallsgymmd.com. That's Rockwalls with an S. You can check out our website, www.rockwallsgymmd.com.
All right. Well, thank you so much for being here today. And thank you so much for what you do and the service that you're providing to the community, because it is so unique nowadays to have somebody who you feel actually cares about you and your family and their well-being. So thank you for being a great asset to Rockwall as a whole and for being a City Lifestyle partner.
Yeah. Well, thank you for having me. I appreciate this opportunity to talk about what I do and spread the word.
Awesome. Well, we will see you guys next time. Bye.
If you are looking for the best place to market your business to our local community, please consider City Lifestyle Publications. I personally own the Allen and Plano territories, but we have over a dozen luxury publications in our area. We are a nationwide brand, so we have over 200 publications across the nation, and we really do value high editorial integrity, beautiful photography, and making sure that your story is told in a respectable and beautiful way. So if you would like to learn more about how to become an advertising partner of City Lifestyle Publications, feel free to reach out to us because we are your ticket in the door to get you face to face with your next client.